Hello everybody, my name is Nestor Leon and I am doing this video on gram stain, and this is for Professor Sarah Rogers for the class of microbiology. So first let me go ahead and start telling you guys a little bit about the difference between the two. Okay, so gram positive, gram negative bacteria. Okay, so we know that the cell wall for a gram positive is composed of a single layer smooth cell wall. Okay, the thickness is actually composed of about 20 to 80 nanometers, and this is for the cell wall thickness of a gram positive. It does provide a thick layer of or multi layers of the peptidoglycan. Okay, it does have some acids. They're called teichoic acids, and the gram positive, they are present in that gram stain. It does not have the liposaccharide present as a protein. The outer membrane is not present, and the liquid, or I'm sorry, the lipid content is very low. It tends to be resistant to antibiotics. Okay, it's very susceptible to antibiotics. The gram positive is very susceptible. Now, in comparison to the negative, okay, we know that the cell wall is a double layer, wavy cell wall. It does have some thickness to it, okay, but it's actually about 8 to 10 nanometers. And we know that it's also a thin layer, often single layered, compared to the gram positive. The teichoic acids, they are not present. It does have the proteins lipopolysaccharides. Okay, they are present in the gram negative. The outer membrane is mostly present. Okay, and they have lipid content. These bacteria, they are very, very resistant to antibiotics. So there is a procedure called gram stain. Okay, when we are conducting this procedure, it's very simple to do. It actually has about 4 steps. Okay, once you actually gather a sample of the bacteria from the infected site, okay, you can easily test it. Normally this procedure is done in a laboratory, and it takes several days because they got to culture it, grow it out, and determine what kind of bacteria it will actually demonstrate. But the procedure is very simple. It says, it tells you to basically apply a primary stain. Okay, and normally we'll start with a crystal violet. Then we'll utilize a Morton. Okay, and normally this is considered with a gram iodine, and this will actually heighten the color, so it can be easily detected once we can determine whether it's a gram positive or gram negative. Okay, then followed by what's called a rapid decolorization with an alcohol, an ethanol or acetone, or you can sometimes mix them together. And then the last step will be actually a counter stain with safranin, and this is a red dye. Okay, so once you completed that task, it takes sometimes several days for it to grow, and you can determine what kind of bacteria the patient will actually have. So the reason why they actually do the gram stain is actually to determine color, size, the shape of the bacteria cells. Okay, so this will be actually very helpful for healthcare providers to determine what kind of infection the patient will actually have, so they can make a plan and treatment, and normally with either some type of antibiotics, and therefore basically the patient can receive the proper treatment based on what they have. Okay, so they actually do collect the dyes and stain the bacteria. One of the questions was asked, why do they use Morton? What's a Morton? Basically, in the gram stain process, okay, they utilize iodine. It does help basically trap and kind of makes it a little clumpy in the sample of the bacteria. It heightens the color, I know that, and I guess it basically it contains it. It provides some kind of like contained layer of the peptidoglycan and the cell walls, and then basically it improves the color so it can be better determine what you know gram negative or positive the bacteria comes out to be. So once the stain is done, if let's say you're determining a gram positive, if the color comes out to be blue to purple under the gram stain, then we can determine that this patient can have some kind of bacteria, Staphylococcus, Streptococcus, Clostridium, or Listeria. And some of the common diseases that can actually a patient have is Streptococcus, pneumonia, Staphylococcus aureus, strep throat, and Clostridium. And this is caused by like food poisoning. So therefore, basically, the provider can give them the proper antibiotic and treatment, so they can go ahead and get better. Now, if the color comes back pink, and this is under the gram stain, then we can determine that we have a gram negative, and you have different series of bacteria that you can kind of determine based on the shapes, the size, and the color. So you have the Neisseria for gonorrhea, you have Pseudomonas, Proteus, Klebsiella, and the Klebsiella tends to be like a nasty one, basically. Like, let's say a patient went in for like some kind of surgical procedure in the hospital, and they got some kind of infection in a surgical site. But some of the other things that, diseases that can determine, you got like your UTI, Salmonella, the Klebsiella, which is on the surgical side, gonorrhea, different types of UTIs, aromas, and other forms of infections. But like I said, the idea is basically to determine what kind of bacteria the patient has based on the colors, provide a proper treatment, give them the medications. They do need to understand that sometimes when it is a gram positive, they can have a little bit of a hard time with the resistance because they're resistant to antibiotics, so that antibiotic may not work. They may need a combination of multiple different antibiotics to mediate that infection and help them out. So hopefully I was a little bit helpful in providing the information and explaining about the gram stain and the procedures and the different colors and what it actually brings out to you guys. Thanks. Bye.